Welcome to Future Talk. On today's program, we're going to talk about technology and health and how instant access to information is leading to new possibilities in managing your health. Later in the show, I'll be talking with Bruce Cohen, CEO of a company called VitaPath Genetics and an active member of the Personalized Medicine Coalition. We'll also show footage from the recent Health 2.0 conference in San Francisco, where numerous companies were displaying their latest products. But now I'd like to introduce my first guest, John de Souza. He is president and CEO of MedHelp, which is the world's largest online health community with more than 12 million unique visitors per month. John is an entrepreneur who's helped found several successful internet startups, including Flash Communications and SmartLeaf. He was also part of a private equity group at Goldman Sachs that invested in healthcare and technology. And he's also a scientific researcher who's worked on guidance systems for robotic surgery at IBM, virtual reality systems for NASA's Neurolab space project, and tools for laparoscopic surgery at the University of Tokyo. He has a master's degree in electrical engineering from MIT and an MBA from the Collège des Ingénieurs in France. And I hope I pronounced that last college correctly.
That was perfect.
Great. So tell me, what exactly does MedHelp do? What does it offer to its users?
Well, thank you for having me on the show. At MedHelp, we saw three significant trends in the healthcare industry that we were going after. The first one was the fact that as individuals, we tend to live longer, and we're also having a lot more chronic conditions, so we need a lot more healthcare. At the same time, when you look at the hospitals and all the healthcare providers, they're not able to provide us with the level of care we need. There are a lot more people entering the system, and so on an individual basis, we get less healthcare. That combined with the fact that all this costs a lot more led to what we call the consumer health revolution. You need more healthcare, you get less of it, and it's going to cost you more. So in order to do this, we looked at a lot of sites out there, and there are a lot of sites that provide you with generic health information. What is asthma? What's cancer? We want to provide you with health information that is personalized to you, and we do it in three different ways. The first is to connect you with other people through communities. The second is to connect you with the best doctors and hospitals out there through our patient-doctor forums. And the third is to give you all the tools and trackers you need to track and manage your health.
Now, what kind of people use your service? You have 12 million people a month. Is there a particular demographic profile of a user?
Because it is health-related, we tend to skew slightly older. The average age is probably around 40. But we found is probably over the last few years, initially we started off being a lot more chronic conditions, but over the last few years there's been a great interest in health. How do I stay healthy? So when you look at our site right now, you have a full population of people that are interested in staying healthy and maintaining the health and keeping away all these conditions, and then people who have conditions that are dealing with those.
So how do people start with this MedHelp? Do they just go to your website and create an account and just do whatever they want on the site, use whatever features they want?
Yeah, the site is free to users. People come in usually because they have a health question that they want to go through and learn about. They come to the site. You can go through and peruse the site without logging on, but if you want to participate in it, you need to create an account, and creating an account is free. So people come on, they have a question, they start reading it, and then they go through as they learn more about their condition and want to ask doctors questions, participate in health chats, or use the tools and trackers that we provide to help maintain their health.
So you have actual doctors that are part of this community also?
Yeah, that's actually a very good point to bring up, because for us in health, we believe that doctors are an integral part of it. And we keep on joking, if you're flying a plane, you want a pilot on it, and with health, you want to have doctors. And so we have relationships with many of the best hospitals, Johns Hopkins, Cleveland Clinic, Mass General. So when you ask questions, you ask a heart question, you can get a response from the #1 heart hospital in the country, Cleveland Clinic.
Now, do people actually rely on this for real medical advice? Because the doctor can't see you. All he's doing is maybe reading a message that you've sent.
So we're not trying to diagnose it, but there's a lot of very relevant health information you can give a user. For example, a woman came on our site and her eye was hurting, it was late at night, and she posted about it, and she found out that she should go into the ER very soon, because sometimes it's caused by pressure buildup in the eye that could cause your optic nerve to die and lead you to get blind. She went in, that's exactly what she had. So getting that information helps you in sort of getting the right diagnosing and the right treatment you need.
So it's sort of an additional tool. It doesn't replace your traditional medical care, but it's another way of accessing information and maybe getting a little bit of an edge?
Exactly. And we're not trying to replace the doctor. We want to improve you getting to the right doctor and have you make sure you have a better conversation with the doctor when you go and see the doctor.
Now, in order to illustrate what MedHelp is about, you brought along some slides, and we're going to show those slides, and maybe you can explain what they're about. So can we see that first slide, please? Okay, so there it is. We're looking at the slide right here. So this cross-platform solutions, what is that telling us?
So the burden of actually taking care of your health has been moved over to the individual. You need to get a lot more involved. And there are a lot of things that people use to take control of their health. They use their cell phone. There are a lot of devices that they use to track their movement or what they eat. But when we looked at this, in the end, you need all this to integrate together to give you a perspective about a condition. I have diabetes, and what does that mean to me? So we actually went through and we sort of built a system that allows you to do exactly that, is to be able to take the data that you enter from your cell phone, from a device, and then view it wherever you are. If you're in the doctor's hospital, how do I show that information to my doctor? If I feel a symptom, if I feel an arrhythmia, how do I enter it where I am? So we solved three things with it: is enter whatever you want, wherever you are, whenever it happens.
So you're owning your own health information and you carry it around with you, sounds like.
Exactly. We believe very strongly that it is your health information. You need access to it whenever it is important to you, and that's how you get better health.
Okay, and now we have another slide. Let's take a look at the next slide, please. Okay, so that looks like three cellular phones with pictures on them, something to do with pregnancy. What's that telling us?
Is the one device that we think has revolutionized consumer healthcare is the cell phone. It's a device that you have with you all the time and can use it to enter symptoms or show information to your doctor. Over here we have one of the applications that we built, which is the pregnancy application called I'm Expecting, that's available on the iPhone and Android. All of the applications are built with two things in mind. It needs to be engaging for the user. Here users can do learn a lot of information, but they can do fun things like take a full baby bump gallery. But it also needs to be medically relevant to a doctor. So we have a full suite of these applications, and on the back end they're all integrated. So if somebody was using our ovulation tracker and then got pregnant, all the data would go from that into your pregnancy. After that, if you have a child, all the data continues to follow on. And so there's a full suite that's actually connected on the back end.
Now with these tracker programs where it monitors your progress, do you have to enter the data manually every day? I'm thinking that maybe that would deter some people if they had to spend the time to enter a lot of data.
So there are two things. One is, you're right, there are some conditions where people will go through and enter data every day, but if people actually use a device and they use a withing scale or something that they step on, we can pull in that data. So if you use a device, we'll pull it in. But we've also realized that you don't need to enter the data every day. There's a lot of value in entering the data periodically, because getting the snapshot of somebody's health over time gives you that longitudinal data that's very important.
Okay, let's go to the next slide now. Okay, so here's a slide that pregnancy symptoms, and there are three colored graphs on it. What's that telling us?
The number one question on our site is, am I normal? People have a desire, no matter what they have. If I have a rash on my hand, is it normal? Should I be concerned about it? And so as people go through and enter data, we help people answer that question is, how does what you're feeling compare with other people who are similar to you? Over here we have a graph that shows you the pregnancy symptoms, 3 of them, for every week of pregnancy. So that if you're in the 20th week of your pregnancy and you have back pain, you can say, is it normal? And what should I expect? What's going to happen? We can also start answering questions like, if you look at women in San Francisco between the age of 35 and 37, what are their symptoms and how do they differ from women that are a different age group?
So your symptoms maybe won't feel so bad if you know that a lot of other people are sharing the same symptoms as well.
Exactly. You know that at least I'm not out of the norm. If you are out of the norm, let's say maybe you should go into check very quickly.
Now we've got one more slide. Let's take a look at this fourth slide now. Okay, there's a map of the United States and it says average mood by state.
So when we went through and started collecting all this personalized health information, we realized that we had this treasure and that we quickly became the largest source of patient-entered data. And we were able to take the data and aggregate it on a local level, a regional level, or a national level. Over here, what you see is we've aggregated all the mood data that we got on a state-by-state level. And you can go through and see the states where people are feeling better and where people are not feeling that good. What's interesting is that if you look at it over the last 12 months, we are actually on a national level at a low point in terms of how people feel. With the lowest, people don't feel that good. And we did some correlation data with states in which there's high unemployment, and there's a very high correlation there. So it allows you to see interesting trends that are occurring across the country and see how they vary over time.
I have a lot more questions I'd love to ask you, but we have to go on to the next segment of our program. We recently visited the Health 2.0 conference in San Francisco, and I interviewed some of the entrepreneurs there. When we come back from that video, I'm going to speak to Bruce Cohen, who is president and CEO of a company called VitaPath Genetics. So let's go ahead and roll that tape.